There are many digestive tract problems that can plague people. These include irritable bowel syndrome, also known as IBS, diverticulitis, Crohn's disease, hemorrhoids, and leaky gut syndrome. Learning more about these conditions can help you understand how to treat them. But before you start, make sure you understand what each condition is all about. This will make it easier to determine the best treatment option for you. This is the Healthy Gut Codex, and we help our viewers fix their digestive tracts so they can live a healthier, slimmer and pain-free life with our research, advice and new findings. If you want access to the show notes or to be updated on new medical findings, subscribe to the channel and click the link in the description to be updated. Now sit back and learn about the 5 most common digestive diseases. First is IBS, that stands for Irritable Bowel Syndrome. IBS is a common, long-term problem affecting the digestive system. It can lead to bloating, diarrhea, constipation, and pain. Symptoms can be mild or severe, and they usually occur after eating. Fortunately, they can be managed successfully. Although IBS can be uncomfortable, it is not a life-threatening condition and does not increase the risk of cancer. In some people, symptoms may worsen during stressful situations or after eating certain foods. Treatment for IBS involves understanding the underlying cause of your symptoms and potential triggers. Treatment for IBS can be individualized and ongoing, and is tailored to each patient. The goal is to improve your quality of life and relieve your symptoms. However, you should remember that IBS treatment is not a cure. A gastroenterologist can determine whether you have IBS by performing an upper endoscopy or a colposcopy. Treatment for ulcerative colitis and Crohn's disease is different and can include diet changes or surgery. A medical condition called gastroparesis can also result in pain in the abdomen. Patients with IBS have a poorer quality of life than patients without IBS. They are more likely to visit a doctor, use diagnostic tests, and take more prescription drugs than patients without IBS. They also miss more work days and lower their overall productivity. IBS is a multifactorial disorder involving interactions between the GI tract and the nervous system. Several factors, including stress, diet, and genetics, may contribute to IBS. Hormones, which affect the time a food passes through the digestive tract, may also contribute to the onset of symptoms. GI problems can be caused by a diet lacking fiber. People with IBS often experience constipation and diarrhea, which can be caused by an inadequate fiber intake. Moreover, eating large amounts of dairy products may exacerbate the symptoms. These conditions can also be caused by an overuse of anti-diarrheal medications. The symptoms of IBS are often exacerbated by dietary fat and monosodium glutamate. Large amounts of liquid with meals may also aggravate symptoms. A diet rich in vegetables and fruits may help reduce symptoms. Avoiding or reducing GI stimulants can also help. Second on our list is diverticulitis. Although there is no cure for diverticulitis, people who experience it can ease its symptoms by following a high-fiber diet. Fiber-rich foods, like fresh and dried fruits and vegetables, help soften waste materials and make them pass through the colon. You can also get your daily fiber requirement from supplemental products such as psyllium or methylcellulose. A diverticulitis treatment can include antibiotics or a procedure that involves the diverticulum's removal. In some severe cases, surgery may be necessary. In such a case, a radiologist will open up the affected area and drain the accumulated fluid. However, in the majority of cases, antibiotics are sufficient to treat the condition. Diverticulitis is caused by inflammation of the small sacs in the colon. Diverticula develop when the pressure in the colon increases, which causes small weaknesses in the wall. These weak spots can bulge outward, creating pouches. Diverticulitis symptoms can be painful and may also result in fever. In severe cases, a diverticulum perforation can lead to local abscess and even a bowel obstruction. If not treated properly, diverticulitis can lead to an infection and may require emergency surgery. If you suffer from constant abdominal pain, you should see a doctor immediately. Additionally, if you are experiencing fever or constipation, you should get medical attention as soon as possible. Home treatment for diverticulitis usually involves sticking to a clear liquid diet for a few days before adding soft foods and moving to a normal diet over a week. A hospital treatment for this condition includes antibiotics and intravenous fluids. Surgery may be necessary for more serious diverticulitis, which requires removal of the affected section of the large intestine. When you are experiencing symptoms of diverticulitis, the doctor will ask you about your symptoms and take your medical history. He or she may perform several tests. A CT scan of the abdomen with contrast material may be helpful in diagnosing the disease. A colostomy may also be needed temporarily or permanently. Diverticulitis is caused by inflammation of the diverticula, which leads to infection. It is more common in people who consume a diet rich in fat and red meat. It is also more common in older people. Diverticulitis is also associated with smoking and obesity. You can reduce the risk of diverticulitis by increasing the amount of fiber in your diet. The third most common is Crohn's disease. Crohn's disease is an inflammatory disease that affects the digestive system. It most commonly affects the colon and small intestine. Symptoms include bloating, gas, and abdominal pain. The disease can also lead to other complications, including infections and colon cancer. The diagnosis of Crohn's disease is usually determined by a series of tests. These include blood tests to check for high or low white blood cell levels. The doctor may also perform a stool test to look for bacteria and parasites. These tests may also rule out infections that cause chronic diarrhea. Another test that may be necessary is a colonoscopy. This procedure uses a camera, light, and endoscope to view the colon and intestines. Treatment of Crohn's disease may involve taking anti-inflammatory medications. These medications help reduce inflammation and relieve symptoms. Some people may also require surgery to remove a narrowed section of the intestines or the entire colon. Surgical treatment can help a patient to live symptom-free for years. While medication alone can effectively control the symptoms of Crohn's disease, the disease can also recur if the inflammation is not treated. In the meantime, natural treatments can help manage the disease's symptoms. A healthy diet with lower fiber, fat, and sugar content can help relieve symptoms and prevent further complications. Keeping a food diary can also help a person manage their Crohn's disease. Although medication is usually effective, surgery is often the last option for treating Crohn's disease. While surgery can help a patient feel better and return to normal activities, it is not a cure. Even with a surgery, Crohn's disease may recur and some people will require lifetime medicines to control the disease. Patients with Crohn's disease may also experience eye inflammation. The inflammation can affect one or both eyes. Patients with this condition may experience uveitis or scleritis, which causes burning and itching in the affected eye. Symptoms of eye inflammation may also include ulcers and fissures. Although Crohn's disease can occur at any stage in life, it is common in young adults and those who are 40 to 50 years of age. Approximately 0.7% of the Canadian population has the disease. Currently, there are 270,000 people living in Canada with the condition. It is slightly more common than ulcerative colitis. Next on the list is hemorrhoids. The symptoms of hemorrhoids can range from pain and itching around the anus to bright red blood in the toilet. While treatment options vary, hemorrhoids can usually be managed with moderate dietary and lifestyle changes. Changing your diet to include more fiber and fluid is an important part of treating hemorrhoids. Fiber helps soften stools, facilitating their movement through the colon, rectum, and anus. External hemorrhoids can develop under the skin on the outside of the anus and may be preceded by straining. The skin surrounding the anus is normally tightly attached to the underlying tissues, but elevated pressure can break down the overlying skin and cause pain and bleeding. External hemorrhoids may also cause intermittent swelling, pressure, and discomfort. There are several causes of hemorrhoids, but the main cause is increased abdominal pressure. Frequent bowel movements and repeated lifting of heavy objects can all contribute to the development of hemorrhoids. Pregnancy is another cause, as the uterus puts extra pressure on the anal blood vessels. Aside from hemorrhoids, many other diseases and conditions affect the digestive system. These conditions can interfere with overall digestion and lead to discomfort. The digestive tract works to break food into small parts so that you can absorb the nutrients needed for energy and use them as building blocks at the cellular level. Food begins in the mouth, travels through the esophagus, stomach, and large and small intestines. The liver, gallbladder, and pancreas are all involved in digestion. Our final disease is diverticulitis. Diverticulitis is another condition that affects the digestive system. The condition occurs when the lower esophageal sphincter does not close properly, causing stomach acid to flow back into the esophagus. Symptoms of gastroesophageal reflux include heartburn, regurgitation, and the taste of stomach fluid in the back of the mouth. Diverticulosis can also cause anal fissures, which are small pouches in the large intestine. If left untreated, this condition can lead to diverticulitis and require surgical removal of the affected colon. Thanks for watching. If you enjoyed the video or learned something new, you should know that we have multiple other channels you can find by looking at our channel profile about other health and wellness topics. And make sure you remember to like, subscribe and hit the bell to be notified when we post new videos.